Welcome back. Let's now turn our attention to the other story that we're tracking. Now, the central government has changed its position on how long it's going to take to vaccinate the entire population. Now, earlier, the government had vehemently claimed that they will finish vaccinating and the vaccination drive as far as all the adults are concerned above 18 by December this year and ensure that all above 18 are vaccinated. But now the Health Ministry says that it's not possible to put out any kind of a deadline or a timeline because of the evolving nature of the virus. Now, this statement by the government was given in Lok Sabha today in response to a question by Congress leader Rahul Gandhi. Those are the latest details here coming in. This is a clear change in stance as far as the centre is concerned, because remember earlier the centre was, had assured that by December 2021, in fact on multiple occasions the statement came in that by December 2021 all above 18 would be vaccinated. But now at this point in time, given the pace of vaccination, obviously, which is which has been pointed out on a number of occasions that it's not really matching up and not going to meet that deadline, and on top of that the evolving nature of the virus, the centre has now said that they are not going to put any kind of a timeline. So it's not just about postponing the kind of deadline that they've set for themselves, but no deadline, no timeline at this point in time as to how long it's going to take to vaccinate the entire population above the age of 18. Now, remember, the issue of vaccine supply has been raised by a number of states, and we have seen that overall, the average pace of vaccination under the new policy, though it began with a bang, it has been tapering off since then. So that is one of the main reasons, of course, where this question has been raised as to when all above 18 would actually be vaccinated. So those are some details here. Ayushman is joining us for more on this. Ayushman, this is obviously now a clear change in the stand as far as centre is concerned. And not only have they not postponed or given a new date, but they are saying that we are not going to put any kind of a timeline at this point in time. And that's not surprising, given that we've seen a consistent decline in the overall pace of vaccination under the new policy.
Yes, Avni. In fact, if you closely look at the numbers that we are getting right now from the Health Ministry, it clearly shows that India is definitely short on the target that it has set for itself. In Supreme Court, the government has said that they are somewhere in a position to vaccinate about 50 crore of the population in the coming July month. So currently we are seeing it at somewhere around 42 crore. So that is something definitely is to be seen whether 50 crore is to be reached or not. But most importantly, Union Health Minister, who is no more Union IB Minister, had earlier said that by the end of this year, we will be able to vaccinate all Indians. Now, somewhere that change of stance has been seen, and in Parliament it has been shown that above 18 years category will definitely be vaccinated. Since vaccination is a dynamic process, of definitive timeline cannot be given. This was a question from Rahul Gandhi, to which the reply came from MOS Health, Bharti Pawar.
All right, Ayushman, thank you so much for getting us all of those details. Let's get a little more perspective. Dr. Narendra Gupta, public health expert, is joining me on the phone line. Dr. Gupta, thank you for speaking to Mirror Now. Your own take and perspective on the entire vaccine drive, the way it's going, and now clearly the centre saying that it's not going to be December 2021, where everybody above 18 will be vaccinated. Now, at a time like this, when the pace of vaccination is consistently slowing down and we are still facing a risk of a possible third wave, what is your own perspective?
Yeah, this is ironical that the date has been changed further. Means there's no clear-cut commitment by when complete vaccination will be done in the country. Is a bit, it's a concern, and it's a concern essentially because you see. As we delay the vaccination, there is always a possibility of the infection to spread as much as it could. And then based on that, there is always a possibility of new variants coming. And then if there are more variants, then there is always a possibility of more breakthrough infections. And if that type of a thing begins to happen, it will be a very serious situation for the country. So, means they need to ramp up vaccine production. Essentially, the deadline for completing vaccination has been, made uncertain because of the non-availability of the vaccine. There is no other reason for this, and this needs to be corrected. This should be corrected as quickly as possible. They should not take any kind of a solace in the fact that the recent ICMR survey has shown very high seropositivity, because that could be one of the reasons for which they may be saying that this process of vaccination need not to be, made fast. But this could be something very uncertain, but and this uncertainty could cause more problems than
Yes.
anything good. So need is that vaccination should happen quickly as possible, and we should try to vaccinate at least 60 to 70% of our all eligible above 18 years population
Yes.
to achieve some kind of a restriction on the transmission.
Yes, and Dr. Gupta, do you believe that, the fact that there was a deadline, of course, maybe December 2021 was perhaps not realistic given the vaccine supply issues, but to put some sort of a deadline does make sense, because it has, at the end of the day, some sort of a psychological impact that you're working towards a certain goal, you're working towards a certain date, and everybody has that in mind.
Absolutely, that's a reality, because unless you don't fix a time limit, you cannot plan out a schedule for it. And in order to plan out a schedule so that you work according to that schedule in order to accomplish what you need to accomplish, you have to fix a timeline, and then based on that you work out backward or forward, whatever the way you want to do it. But then you work out how much vaccination should be done daily, depending on the availability of vaccines. And then means the government should also ramp up production of vaccines so
Yes.
that more and more vaccine is available. We have the human resource available to carry out the vaccination. It's just the issue of the vaccine, which is on. Once when we could achieve 80 lakh vaccines a day, we certainly could even go up to 10 million a day. And if that happens, then we could, vaccinate a large number of people and complete vaccination of all eligible people within a short period of time.
Yes, absolutely, Dr. Gupta. That, of course, is an extremely important point. Thank you so much for joining us with your perspective at this point in time.